Hi, my name's Greg Felt and I'm Director of Public Health for Sheffield. This is a short video on where the city is as of today. Most of you will have clocked the headline that was in the Observer on Sunday, the list of places at risk of lockdown. I'll give you kind of the where we are as of today. So the numbers in Sheffield are higher than they should be, and I've said this consistently throughout, and they're proving quite stubborn to get down. It's not fair to say that Sheffield's at risk of lockdown. The numbers in Sheffield are nowhere near the numbers in Leicester. Nowhere near, different league altogether. However, they are higher than is comfortable. Certainly I'm not in a position of any comfort here. And they're proving a bit stubborn to get down. So one of the things that we agreed to do last week as a team and the Director of Public Health, I led that team, is to re-emphasise and re-energise our strategy, particularly focused on testing, increasing access to testing and making it more available and more accessible. And we're particularly interested at the moment in those who have really mild symptoms, and we know there are lots of people who have really mild symptoms coming forward for testing, and the reason we want to do that is to break the chain of transmission. It won't take a huge amount, but we do need to do something a bit more to break the chain of transmission. So the numbers are not massively high, but certainly higher than I'd want them to be, and we need to push them down. So we're kind of going to get into the business of testing, and we're going to be much more nuanced and much more focused about that. We probably won't yet get into the business of offering screening, i.e. testing to those who don't yet have symptoms, but that will come, and I don't think it will be too far away. But at the moment we're focusing our testing, as per the national strategy, on those who have symptoms. The standard messages kind of still apply. This is an illness that has not gone away. 5% of us were infected in wave 1, so 95% of us are still susceptible. So we're in this for the long haul, and we need to continue to push the level of circulating virus down and down and down again. So we're preparing for winter now. Winter is always really problematic for both social care and for the health service, and we need to be as prepared as we possibly can. So the core set of messages: stay at home if you have symptoms, and that does mean stay at home. It doesn't mean go to church, it doesn't mean go to the mosque, it doesn't mean go to shops, it does mean stay at home. That is by far the most important thing that we can all do if we've got symptoms of the illness. We all know it's a pain, particularly if you've got really, really mild symptoms. But it might be mild for me or you, but it might not be mild for the person that you pass it on to. So important message number one. Secondly, distance. Beyond 2 metres, the risk of transmission, particularly in an outdoor setting, is negligible, and even actually in an indoor setting, it's fairly minimal. So distance still matters. Hand washing still matters. And we all know how the virus is transmitted. It's transmitted when we put our hand, which may have been infected or may have picked up the virus, to our mouth. But getting our hands washed regularly is the most important thing. And get tested. If you've got mild symptoms, please get tested. The vast majority who get tested will test negative. We know that. The proportion of positive tests is 3 to 5%. It varies a little bit from week to week, but it's in that order. So, but it is important to be sure that you don't inadvertently pass that virus on to somebody who may not have mild symptoms. So collectively, those things are going to make a difference to pushing the level of circulating virus low. But I just want to reassure people of Sheffield that we've got definitely the right strategy. We've had that in place for a while now, but we're going to continue to push the get tested and get tested early message in the communities where we know we need to push that really hard.